Good evening and welcome to the Nutricia webinar on getting great outcomes from virtual interactions with patients and peers. I'm Carol Widows, Clinical and Operational Lead for Dietetics and Head of AHPs for East Sussex Healthcare NHS Trust, and I'm your chair for this evening. Digitally enabled healthcare has been part of the long-term plan agenda to support our ever-evolving healthcare system needs. However, I don't think any of us anticipated the speed at which we would have to introduce virtual platforms. Usually a process that would take 6 to 12 months to even get to the point of embedding a process in took my trust, ESHT, about 6 to 8 weeks with a rapid accelerated plan. Our population is more than ready to receive virtual technology and healthcare, particularly where they hadn't previously been prepared. Friends and family have been keeping in contact through virtual platforms during lockdown, and more than ever, the population wants to support the NHS, but still maintain that contact with services. Through our trust, ESHT, we adopted Attend Anywhere as our platform of choice and a telephone call as a backup if Attend Anywhere didn't work. Understandably, staff had a lot of concerns around how this was going to work, not knowing the system, how it would work for patients, how it would work with IT systems, as well as the aspect of not having many office space left for confidential calls due to social distancing. It's been a constantly developing picture, and even today I had a meeting about virtual world and how we adapt Attend Anywhere further for us as a trust. But staff have found it really beneficial being able to see their patients and have that contact and build that rapport again, which is very difficult to do over a telephone call. ESHT as a trust has been really lucky to trial the Nutricia Homeward app for enteral feed patients, and this is added on to our Attend Anywhere use. We've been able to schedule ad hoc contacts with patients. For example, if a patient calls the office and something isn't working for them, rather than describe it over the phone, if they're able to use the app, we can have a video call with them and be able to see straight away what the problem is. And I'm sure a lot of you on the call tonight have been there when someone's trying to describe something and you have no idea what they're going on about. I've used it myself with a patient and one of our enteral nurse specialists, and it's been really helpful when the nurse has been in the room with the patient and I've effectively been there but in a virtual capacity. And it's really helped that joint appointment strike back up again and flow. So moving on to tonight, please post any questions that you have within the chat function as the presentations play, and then the questions will be answered at the end by speakers and myself. So without further ado, I will hand over to Kirsty for her presentation.
For joining us, and thank you to Nutricia for inviting me to speak to you this evening. My name is Kirsty Dobson. I'm the Principal Acute Lead Dietitian at Brighton and Sussex University Hospitals. We've got a team of 16 adult acute dietitians, and we're part of a wider team of adult and paediatric community and acute services. And we run 20 outpatient clinics a week in the adult service, covering general, gastro, diabetes, IBS and maternal health. So just to give you a little overview of what I'm going to cover, give you a little bit of background of my experience with telehealth, a definition, the positives and negatives, so not just for the patient, but also for yourselves as healthcare professionals, a little bit about setting up the logistics of running virtual consultations, and my sort of top tips for helping to prepare for the consultation, what to do during the consultation, and to ensure that we've got good follow-up afterwards, because we may need to adapt our processes compared to face-to-face consultations. So a little bit about what telehealth is. It's a provision of healthcare remotely by means of telecommunications technology via mobile phone or video, or through the internet in the form of video calls. It's a broad range of technologies and services developed to provide patient care. Telehealth is different from telemedicine, which is specific to providing remote clinical services. The World Health Organization classify telehealth as being surveillance, health promotion, and public health function. So it's a bit more of a broader term and can incorporate some of those health promotion activities we might do as dietitians, such as running cardiac rehab group sessions. So the reason why Nutricia asked me to do this is I have been doing telehealth for quite some time now. Back in 2016, we knew we had a bit of a problem with our IBS pathway. We were running quite significantly high do not attend rates, DNA rates at that time of 28%, which compared to the national benchmarking data with an average of 12% showed that we had a significant problem. So in order to understand the barriers, we surveyed our non-attenders and those people that didn't take up the invite to book an appointment. I'm just going to move on to the next screen to show you the details of that infographic a bit more clearly. So the bar chart outlines some of the reasons that were given in that survey, and a lot of these are interlinked. So for example, quite a few people said they no longer required advice, and that was often in relation to the fact that they were waiting quite a long time to talk to us. Again, the national benchmarking audit showed that the average waiting time to see a dietitian was 41 days, and our service was running around 56 days at the time. So it meant patients were then forced to go and seek advice elsewhere, perhaps in the private sector, or used the internet or bought a book or even spoke to their auntie to get the information, and then they no longer required our services. But there were also a number of social environmental factors that were brought up, such as difficulties with childcare or taking time off work, or the difficulty with accessing the clinic, getting to the hospital, parking, those sort of things. When we surveyed them as to the best way of trying to improve our service, we were bracing ourselves to having to work evenings and weekends, but actually a telemedicine service was the preferred method. So we adapted our pathway and introduced a phone call for all patients referred to us for IBS as a way of triaging them to see whether they were appropriate for group settings or complex diets such as the FODMAP diet, or whether they needed to be kept in a FODE service or put into a one-to-one clinic. So following the introduction of this IBS triage and first line advice telephone service in 2017, we actually reduced our DNA rates down to around 5% and halved the waiting time to speak to a dietitian. Obviously, it was a change in service, so we had to make sure that it was going down well with patients. So we sent out patient experience questionnaires, and these were really highly evaluated with more than 95% satisfaction rates, and 73% of patients saying that they would recommend a phone service for other aspects of their healthcare to their friends and family. So what are the good, the bad, and the potentially scary aspects of providing this form of virtual consultation? Well, in the current climate, the top of the list has to be health and safety. We really do have to minimize risk and prevent unnecessary social risk mixing. So this reduces exposure of patients and staff to infections by conducting remote consultations. It's also hugely convenient, both for the clinician and for the patient. It does save time, and you're also saving money. We're not having to pay for clinic rooms. Patients aren't having to pay for travel or for parking at the hospital, and also they're not having to take travel time out of work either. And patients can use their preferred location, whether that's at home. Often patients will block out an hour in their diary, their work diary, and book a meeting room to go into so that they're not disturbed for the consultation appointment time. It also helps with timeliness, and it can be more immediate. It can help to reduce waiting times, as I demonstrated with the introduction of our IBS phone service, but also it can make your consultations much snappier, particularly if you take the time to design a pro forma which will take you through the consultation, and I will touch on that later on in the presentation. It's also very much a judgment-free zone. Patients often find it's easier to discuss embarrassing or potentially sensitive issues if they're not looking at someone. So I'm thinking really more in terms of your phone consultations here. And I know, because I'm a gastro-dietitian by background, I spend quite a bit of time talking about poo, the color, the consistency, the smell, and how easy it is to flush away. And it's not easy to talk about those things if you're eyeballing somebody. So patients often find, when I give them the choice at the end of the consultation, do you want to follow up as a video call or as a phone call, often they'll say to me, I'm quite happy with phone. And if we were to pass each other in Sainsbury's later on, we would never know we'd spent the morning talking about poo earlier on, because we don't know what each other looks like. So there are some advantages there. Obviously, it's very easy to use. Most patients have access to a mobile phone these days, and even the video calls are quite straightforward. Within our trust, we use Attend Anywhere, which is a very safe form of video calling, as it's behind the NHS firewall. And it's a very easy web-based program and there's a simple guide that we send out to patients, but it does require a degree of IT literacy, as well as having a good broadband connection or reliable Wi-Fi access, because you don't want it to be glitchy. You want to make sure that you're capturing all of that information. I think this is really a useful point to really embrace the developments that are happening with technology and really empower patients to manage their own conditions long term, particularly if they have a long-term health condition such as diabetes. And here at the bottom, you've got a picture of the Freestyle Libre app. There's apps such as MyFitnessPal, which is quite widely used by dietitians. Patients Knows Best is something that we're currently using in the hospital for outpatient scheduling, but also I've used in the pelvic radiation disease service, monitoring patients' bowel symptoms long term. There's also ability to keep a food chart on there, as well as being able to have contact and messaging with your clinician, and an ability of, to have your test results transferred over there. So it's a really good way to empower patients to look after their long-term health needs. And also it's a good way of signposting people. If you're using virtual consultations, then it's very easy to send links to things like patient webinars. And we used and have recommended them an awful lot, particularly the FODMAP webinars, when we weren't able to run our group setting sessions on the FODMAP diet during the peak of the pandemic. The negatives, though, it is less personal, and you can't really get away from that. It's not quite the same as having the patient in front of you, particularly if you've not met them beforehand. So you really do have to make some time making them feel at ease and really building that rapport with patients. And of course, we can't replace everything that we would do in a one-to-one consultation online, because we aren't able to visually do the assessment that we do almost subconsciously without thinking about it. And we aren't able to do the anthropometric measurements that we would ideally be doing in clinic. So it is important to make sure that there is some kind of method of monitoring at home. And we may well miss the visual cues. When you've got someone in front of you in clinic, it's easy to pick up if they haven't quite understood, or if they were about to say something. You might often find during phone calls particularly, but can happen with video calls as well, is that you sometimes talk over each other because you haven't got that one-to-one connection that you would have, and so you're missing the visual cues. And it's really important that you try and adapt your resources to the situation. I mean, a lot of dietitians, such as myself, that are quite old school, been around a long time and doing this job a long time, use our diet sheets as a bit of a prop. I know particularly when I'm doing FODMAP education, because it's quite a complex diet, going through the diet sheet as you're explaining the treatment plan is really is an easy thing to do in clinic. But you can't do that when you're on the phone, because they're not going to get the diet sheet until a week after the appointment time. So you really need to think about the way you're going to impart that. And it can be useful to do things like sharing your screen. So if you're doing a Teams a Teams meeting with somebody, you can share your screen, or sending them links to some resources afterwards, such as I know Monash University have got a really lovely infographic on YouTube on the FODMAP diet and the way the fermentable carbohydrates work in the body, and that can be really useful if you've got someone that thinks very, that likes things given in a visual way. So what's involved in practically setting up a virtual service? Appointment scheduling is by far one of the benefits of this. We get freedom from the Friday afternoon clinic room slots, the slots nobody wants to do, nobody wants to run a clinic on a Friday afternoon. We've completely rejigged how our clinics look across the week now. And owing to social distancing, because we've got quite a cramped clinic office, we've had to introduce staggered start times. It means if we can give the dietitians the freedom to do a clinic from home and move that clinic to the morning, they can then do their clinic admin in the afternoon, and then they might have an hour or so to do a little bit of CPD or do work on a diet sheet or do some of their mandatory training. So, and it means there's one less body in the office for that day. So it helps with that as well. It's really important that we continue to give people choice. So primarily we're encouraging video or phone consultations because of the health and safety aspect during the pandemic, but being aware that we still need to have a facility for face-to-face consultations, because there are some patients that just simply aren't suited to that, and those patients that we can't monitor closely at home. So if we can't get them weighed at home or in the community, then bringing those patients to clinics really important. If you've got patients that lip read, for example, it can be really difficult if you've got a glitchy video connection. They're going to be missing some of the content and some of the sort of learning difficulties, hearing loss. Sometimes it is just much easier to do it face to face. So we have a certain number of general clinics and a certain number of gastro clinics every week that we still run from a clinic room, so that we, even though the majority are booked as virtual consults, we do have that ability to be able to see face to face if we need to. It's really important when we're offering these appointments to patients that we set the scene appropriately, and our administrators are very good at letting the patients know that it's very much a like-for-like replacement of a traditional clinical consult. They will be called at or around the time of their clinic appointment on the letter, and it's important that they make sure they're in a safe, confidential space and they're not going to be interrupted for the duration of the appointment. The same way the clinician has to find a confidential space where they're not going to be interrupted. We do provide patients with information leaflets, and that's what you can see on the right-hand side of your screen. This is the one that we send out for Attend Anywhere with the simple web address, and that takes them into a waiting room. It takes them easily through how to test their equipment so that they're all ready ahead of the video call. But there's also links to YouTube demonstrations so patients can feel they've had a chance to practice it ahead of the appointment slot. It also helps as well to try and collect as much data prior to the clinic as possible. This really helps with the efficiency of your consultation. So we send out gastrointestinal symptom severity scales with our appointment letters to our gastro patients, so they have their chance to do that assessment and that screening, and they have it to hand ready for the consultations. We often send out food and symptom diaries, which they return to us by post or by email, and often patients will send us data from their monitoring apps as well, so particularly the diabetics, so that the dietitian has got a bit of a handle on what's been happening with their blood glucose control in recent weeks. For you as a clinician, I think it's important to acknowledge it is tiring. It's tiring because you have to concentrate, because you are not getting all of those visual cues. You have to really hone your listening skills, which requires quite a degree of mental effort. And so that's why it's important to make sure that you're scheduling regular breaks. And it's also important to go with the flow. You have to be adaptable. Things don't often go to plan, so it's always good to have another plan B in the back of your mind in case things don't go accordingly. So in terms of preparing for the virtual consultation, really a lack of preparation is going to be much more obvious in the virtual world than it will in a one-to-one, so we can't really wing it. And it really helps, I think, to develop and spend time doing some pro formas, because it really helps to guide your consultation through the information gathering, the assessment and treatment planning. And it really helps just to keep everything running on time. So this example on the right-hand side of the page is just our general dietetic assessment form. If I just flick to the next slide, this is the one that we use for our gastro patients. So this has the symptom score incorporated it in a bit more detail about bowel, but as you can see, it takes you through the assessment stage, any relevant investigations or blood results, their anthropometry, what their symptoms are like at the moment, bit about their medications, their current symptoms that they're struggling with, and then the crux of the nutritional assessment, their requirements and the diet history and so on. It's important that you're prepared. The more you can prepare, the more professional it will come across. So make sure that you're looking professional, you've got everything that you need to hand for it, and practice your opening spiel. This is particularly important if you're trying to give important information about what to do if things go wrong. So, you know, how to refresh the screen if you lose the connection, or sorting out the plan B if you lose internet access or Wi-Fi if it's not good enough, and also making sure that they're in a confidential space, that if there's anybody else in the background, if they want to be part of the consultation, that they're visible on screen and that they've introduced themselves so that you know who's listening into the call. It's important they test their equipment as well, and the Attend Anywhere does take the patients through that, and the clinician as well, before you join in, so you've had an opportunity to make sure everything's set up before you open the call. It's a good idea to use a good quality headset, whether that's one to go into your phone if you're using a landline, or into the computer, the PC or the laptop if you're doing virtual consultations. It just helps to reduce that noise. So avoid using speakerphones, because you do get a lot of background noise and it doesn't sound very professional. And it's good to make sure that your camera is set at eye level as well. You really don't want to be talking down to patients or up to them, actually. So having your camera at eye level is nice and natural. And always have a plan B. So make sure that you've got another method of contacting the patient if the video call fails for any reason. Oh, sorry, I skipped on too many there. So during the virtual consultation, to try and get the most out of the appointment time, it's important that we're first double checking that the patient is who we think they is. So verify their ID, make sure they're in a confidential space and that they're not going to be interrupted. And it's important that you seek permission to take notes. I think it's quite important if you're going to use the computer to take notes while you're doing it, patients will often be able to hear the tapping in the background. And so I think it's important that you make note of this. Otherwise, they may think you're responding to emails while you're on the call to them. So you can say, you may hear me tapping on the keyboard as I take some notes of our consultation. And I think it also helps to, while you're setting the scene, to make sure that you're managing their expectations with regards to how the call is going to go. So I normally say we've got about half an hour today. I'm going to start by asking you quite a few questions to collect all of the information that I need for the assessment, but don't worry, there will be time at the end of the call. So if there's anything that has come up that you're unsure about, we'll have time to ask as many questions as you need at the end. So it allows them to know how the consultation is going to run. It is important you manage distractions, so shutting down your email program so that you haven't got emails pinging up in the corner of the screen, because that can be incredibly distracting, particularly while you're doing video consultations. Making sure that your personal mobile phone's on silent, and if there's any noisy drilling or anything going on outside, shutting the doors and windows just to make sure that that space is as quiet and as protected as possible. Regular breaks is really important. So we don't do any more than 5 30-minute consultations back to back, because we find that it is tiring, as I said, because of the degree of concentration and listening skills that are required. And also after 2.5 hours, you really need a wee. So it's important, it's important to have a bottle of water on your desk, because I find talking a lot, it dries your mouth out. So it's important that you look after your well-being and make sure that you're taking some regular breaks. Time management as well, it does help if you can let patients know to try and make themselves free for about half an hour either side of the appointment slot, in case we get somebody a failed contact prior to them, and so that we might decide to call them a little bit early, or if we're running late for any reason, that they've ring-fenced that time so that we know that it's protected for the consultation. You can also use chat box facility. So if you're talking with someone through Microsoft Teams or with Attend Anywhere, there is a chat box facility where you can just reassure patients that you know that they're waiting, you're just running a little bit late, and you'll call them as soon as you finish with the previous patient. It just acts as a little bit of reassurance. And it's important, as I said, to allow time for questions at the end, particularly if there are any difficulties getting online and getting anything set up at the start of the consultation. You don't want them to feel like they're going to run out of time. So following this, it's really important that you, again, offer choice as to how they prefer to be followed up. And many people are over the whole Zoom thing now. They've done their quizzes, they've done their social nights, and they've had loads of work meetings on Zoom. So quite a few people actually now say to me, actually, I'm quite happy with a regular phone call, and that's fine. I mean, for our particular, my particular patient group, then that's often lends itself quite well. But with your oral nutrition support patients, that's when it can be a bit more challenging, particularly if they're struggling to get weights at home, because you really need to think outside the box of how you can assess how your oral nutrition support plans are working if you haven't got that anthropometric data to hand. It's important that we do supply backup written resources of the information that we've given to help reinforce the recommendations that we've made, and that can be by email or post. But also, if you're emailing patients, it's really easy to give them links to further reading, blogs, or patient webinars, again, which helps to reinforce the message that you've given them. It's important that we document the consult, and I think if you haven't done it already, now is a really good time to go paperless, because electronic notes massively reduces the risk of potential data protection breaches if we're not having to transfer patients' record cards from the main office to our homes if we're working remotely and doing virtual clinics from home. So we've during this process have gone over into, I mean, we were already doing paperless for our inpatient notes, but we are now doing it for outpatients as well, and it's so much easier. But as I said, some people do still prefer to take notes on paper and use the pro forma and then scan it in and save it, the electronic version, and then shred the paper copy at home. So it is worth spending a bit of time thinking about how you're going to document your consultation. And it's important we continue to monitor effectiveness. So look at your outcome measures and how you currently assess the effectiveness of your input. Do your existing outcome tools need to be adapted at all? Can you incorporate any patient reported outcome measures, any quality of life indicators into your assessments, alongside some of the more traditional things like the symptom severity scale we use in gastro? And it's important for any change in service provision that we're evaluating it and seeing how it lands with our patients. So using a patient experience questionnaire is a couple of example questions from the one that we've used on the right hand side of the screen there, which just gives us a bit of an indication of how it's being received by patients. So in summary, I think it's time to embrace the change. COVID-19 has completely changed the way that we interact and communicate with our colleagues as well as our patients, and there can be a huge number of benefits to this new way of working, particularly, I think, promoting the use of self-monitoring for long-term conditions. It's important the more time you spend setting up and preparing for your virtual service, the smoother the clinics will run. It is really worth investing some time in looking at how this will develop for you. And as for your face-to-face appointments, it's really important they remain with the patient right at the centre of everything you do. So it's important you consider their preferences, their treatment goals, and their clinic outcomes. So with the goals, making sure that negotiation is still happening and checking that they've got it, you know, getting them to repeat back what the treatment plan is to make sure that it's all been understood, because you're missing it, you haven't got those visual clues to go on. it's important you really get familiar with the technology that you're using and practice your opening spiel. So if it's about, not recording the session, refreshing the screen if you're losing connection, those sort of things, the standard opening lines, it's important you have that off bat. And if it all goes wrong, just take a deep breath and think about your plan B. And that's often the phone and picking up and talking to them on the mobile if you lose your video connection for any reason. And as I said, it's always important to remember to evaluate the new service through patient feedback or regular audits to make sure that we're hitting the mark. Thank you very much for your time.
Thank you, Kirsty. That was extremely valuable, and definitely some aspects we'll be pinching with pride over at East Sussex. So next up we have Dr. Scott Cray, and I will hand over to him for his presentation.
Hi, it's great to be speaking to you. My name is Dr. Scott Cray. I'm a founder at Talking Medicines. I'll tell you a little bit more about that in a bit. But for now, welcome to Top Tips for Running Successful Remote Meetings and One-to-Ones. So first things first, in the immortal words of Douglas Adams, don't panic. Video conferencing is just a tool. It's a digital tool. It helps communicate more effectively. And we've all been communicating for all of our lives. So we've got this. I'm going to call this presentation How to Win Video Calls and Influence People. And hopefully at the end of this short summary, you're going to feel more confident and more ready to present your best side to the world in any video call scenario. To do that, I'm going to run through a few key points. How has vision changed the way that we communicate? What's the etiquette? We're always worried about etiquette, getting things right. How to set yourself up to look your best and present your best in any video call situation, some practical hints and tips from in the field, and how to keep control, particularly important when you have a larger audience. We've got some nice all right on the night moments to share with you where people have got it wrong, and we're going to be chatting about the old maxim that practice makes perfect and what platforms are out there. So as long as we're happy with that agenda, and by the way, I'm happy to take any questions at the end of the presentation. All set, let's dive straight in. So, Talking Medicines, we've been around for a long time. That's me on the left with my co-founders, Joe Halliday and Elizabeth Fairley. We've been working in digital patient support programs and delighted to say that we worked with Nutricia on the award-winning Nutricia Homeward app, as we're delighted that Nutricia have now won the Patient Experience Network National Award for their app and the work that they're doing in connecting with 29,000 patients in their own homes. So what is all this video communication that's going on? How has vision changed? Well, this is evolution, not revolution. So video and sound merged probably for the first time, according to the pundits, back in 1975. Doesn't that seem like a long time ago? When Bohemian Rhapsody changed the way we consumed music forever. The first video for music, and that spun off an entire network and an entire change in the way we consume. Things like MTV, YouTube, and TikTok for the younger generation. We're all about video, we're all about communication, we're all about sound and vision coming together. And that is reflected in the way that smartphones have been adopted. Now, more than 85% of people in the UK own a smartphone. Fastest adopting group? The over 65s. They are there, the grey pound spends, and people want useful content. In fact, 31% of people who are using the Nutricia Homeward app are over 65. And of course, we must mention it, we are only seeing this adoption accelerate through COVID-19. So what I'd like to do for the rest of this presentation is abandon the word digital, because digital sounds separate, digital sounds scary, and let's talk about useful. So if a video call is useful and the software is well designed, then you can concentrate on your presentation rather than the tech, and so can your audience. Minding your P's and Q's, of course. All communications these days are online, and we've had to adopt very quickly new ways of communicating with each other, and the protocols, the right way to do things. None of us want to be Julia Roberts in Pretty Woman using the wrong fork. So we need to think through the etiquette, and I think this comes down to knowing your audience, being prepared and ready for the call, having all your paperwork, your results, your references, your background work done, and importantly, it's about being welcoming. Always good for the presenter to be seen, at least at the start of the presentation. Give a wave if it feels comfortable. Greet individually if it's a small group, or greet everybody joining. Keep that communication going right from the start. Don't leave dead air space, that horrible staring at the computer, that Radio 4's gone silent moment that we don't want. Invite people to comment or just say a couple of words about who they are and where they're calling from. Makes everybody feel engaged right from the get-go. This is your time to shine, so make sure that you've got your sound and your vision right. So optimize your space. And what do I mean by optimizing your space? Well, you're the director, you're the producer, you're the scriptwriter of your own production. So think it all through. Check out the space around about you, minimize distractions. Don't worry about the kids running in. If it happens, it humanizes us. It helps us to connect. Do beware of echo. A lot of people are heading up to the attic because they think they can get away from all the noise, but actually big cavernous spaces with little furniture, no soft furnishing, no bookshelves to deaden noise will create a lot of sound, a lot of distortion, and a lot of distraction. Choose your best side when it comes to getting your vision right. Casual's the new smart. I don't see people wearing ties anymore. Use indirect lighting. By that I mean don't sit with the window behind you. We don't want you in outline. We want to actually see your face. And if you're going to use professional lighting, and some of you may, do practice, and do practice for a long time. Some of these things will heat up. Most important thing I would like to pass on is to choose the height of your webcam, and that requires only a few books to get the height right, so you're framed nicely in the picture, and so that we're not looking at the top of your forehead or looking up your nose. And beware of video off and on. Don't always trust the button. So if you were thinking about only dressing the top half, just be a little bit careful about that. So how do you end up being the host with the most and not losing control of the guy on the right? I think 90% of communication is non-verbal, so keep your own face in view. Remember to smile and look relaxed and sympathetic. Really important to control your own breathing, keep your shoulders down and be relaxed. Once you're relaxed, you're in charge, you're in control. Do you need support? Do you need something to hold your computer or your phone? Do you need your hands free to take notes or to use things? Be aware of that before you start. And of course, the other 10% is very important, the voice, which can very quickly become the disembodied voice if you are doing a presentation which involves lots of slides and you're not being seen. So do avoid reading everything that is on the screen. That is a really annoying and bad habit. Vary your voice, vary your tone, try to slow down. There's a tendency to speed up during any presentation. And don't try to rote learn. You know your stuff. You've been invited to talk or to communicate for a reason. Trust in yourself. You've got this. So how to keep control of wider audiences? Here's an absolute expert, Mr. Bercow, a speaker in the House of Commons. And what he did is to let the audience know who is in charge, very politely, but very passively as well. Give an overview of the agenda, let people know what to expect right at the very beginning, give a time scale. This is really important with lots of people now having back-to-back Zoom conferences. Funnily enough, hasn't productivity gone up? We've all got these really arranged tight meetings with tight deadlines. So be aware, somebody may have a hard stop on their meeting, so you can't afford to go on too long. And let people know how and when they can interact, particularly important with questions. Allowed questions during the call, that might be fine, but you're going to have to manage those, or they might be able to use chat boxes to bring them all together. You might want a moderator to do that, probably not the chairman. They're very busy managing the speakers and making sure everybody's connected. Get a second moderator who can pull these questions together. And so a great example of that with Dr. Tony Young, who's the Chief Entrepreneur at NHS. I had a presentation on him on Friday night where the moderator filtered all the questions but then opened the mics and video to those asking them so they could be seen and heard. And that brought a real feeling of connection to the audience. I think that was a great way to do things. Common platforms, you've probably seen a lot of the common platforms, things like FaceTime and WhatsApp on your phone. You might have used some of them. And then there's more business orientated ones. There's Microsoft, you have the Teams, which integrates into all the software, and there's Zoom, which is a very popular system as well. And of course, there are more specific ones around specific tasks like the Nutricia Homeboard app. So I think the most important thing is to be comfortable and to have used those. If you're invited to use Teams, you've never done it before, get on Teams, have a play. Most of these software options have a free to play option as well. So find a friend, download them and have a shot. Press the buttons, make the calls, disconnect yourselves by accident, find out all the things that you need to do. How do I mute? How to turn my camera off? How do I share my screen? Have a play. Don't be frightened to have a go. And like I said, it'll cost you nothing, but you become much more confident with them over time. Things that let you down, because of course, unfortunately, not everything goes right all the time. So usually it's either tech or it's habits. So be aware that having the wrong device, and by that I don't mean whether or not you've got a shiny new Apple, but trying to share a spreadsheet with somebody over an iPhone or for a small screen is going to be really difficult compared to sharing that over a laptop. So get the right devices right. Think about your Wi-Fi and your broadband. Sharing is not caring, so I blame Fortnite for most of the problems that we have in trying to share Zoom calls. Teenagers playing this massively data-dependent game. So try and have your own line, your own time, or at least let anybody else in the household know you're going to be making an important call. Get everything fully charged and be sure your devices, your headphones are all connected up and your computer is ready for that connection, as well as the software. So think computer connections and permissions, and the software connections and permissions, two separate things. Have a plan B. Always good to have a plan B. So make sure you've got a list of the contacts of people coming in. So if you are delayed, if there is a technical issue, you might be able to get an email sent out to them to say, hold on for 10 minutes, we're going to retry, or sorry, we're going to have to reschedule. And people are used to that. It's a letdown, it's disappointing, but it does happen. That is just life. Be familiar with the video conferencing, and do be aware that an important call is not the best time to experiment with the latest brand new software. So we want to be practically perfect in every way. Apologies to Emily Blunt, there is only one Mary Poppins, and that is definitely she. So the basic skills that you need, you should be able to open the presentation up. You should be able to control access to any screens that you want to share, and be able to manage your sound and video, and be confident that when your screen is on, it's on, and off, it's off. You should, as a presenter, be able to mute other participants, and that can be very useful. And you can also end other participants' calls. Unlike this now that somebody's been non-cooperative, you can just gently exit them from your presentation as well. Do take time to practice. Can't emphasize that enough. The more comfortable you are with your software, the more you can concentrate in your presentation. So in summary, do not panic. This is an evolution, not a revolution. I've got a typo there. Communication does not rely upon technology. Digital isn't a thing. It should be facilitated. It should actually make you feel good. And if it doesn't make you feel good, try another couple of apps until it does. Think about your audience, be welcoming, create a safe space for people, set up the ground rules. When can you ask a question? When can you interrupt? Have a backup plan, so have that copy of a PDF of all your notes so you can keep going even if the tech lets you down. Don't experiment with live audiences, and do experiment with platforms. And if you manage all of that, you'll set expectations, you'll have a feeling of keeping control, but above all, the most important thing is to just be yourself. Thanks for listening. My name is Dr. Scott Cray, and I'm very happy to take any questions. And if you do want to get in touch, my details are at the base.
Fabulous. Thank you very much, Scott. That was certainly some key things to remember there, as well as some top tips that I think I might be introducing. So over to questions. If we start off, I think quite a few of them are for Kirsty. So Sharon has asked, which FODMAP webinars do you use? And do you use any food and symptom diary type apps that patients can share with you?
So we've been using patientwebinars.co.uk, which were recorded by dietitians down in Somerset, and they've got quite a big range of patient webinars, not just on IBS and both stages of the FODMAP diet, but also on celiac disease and a range of other conditions as well. So they've been hugely important, particularly when we haven't been able to do some of our group education. For gastro, we haven't actually been using any apps for food diaries. My only experience has been using Patients Knows Best, where there is a diary function, but I'm not sure it was particularly written in conjunction with a dietitian. So if I was going to have a stab at it, I would do things slightly differently. But I know there are a lot of functionality. So often in the same way, when we see patients face to face and they might bring their mobile phone, smartphone out and show us an app, we are encouraging them them to share that data with us ahead of the appointments if they can, or by email.
Fabulous. And then there's a question from Vary. How do you go about supporting someone who's emotionally affected with what's going on, for example, is crying in a virtual consultation?
That is tricky. And in the same way, in fact, I've had moments during the pandemic when I've been with colleagues or with staff members that have got upset, and the natural reaction, I'm a very tactile person, my natural reaction is to want to reach out and touch, and we can't do that in person at the moment. So I think it can still translate. I think you can still build a rapport and show empathy in a virtual way. It's not quite the same as, the micro little signals that you might give that you can be a bit more aware of when you're in person. You maybe doesn't translate on the phone, but acknowledging and listening and showing those reflective listening skills and summarizing and saying, it sounds like you're having a really tough time at the moment. Perhaps now isn't the best time, but please use this time. It's yours. If you want to talk about other things, because often you may well be, particularly those people that have been shielding, for example, you may well be the first person they've spoken to for a week. So if you don't get to do the nitty-gritty of the dietetics, it's not a wasted consultation. You're reaching out to people, which is really important at the moment. We all need to be looking after each other's well-being, and just because it's in a virtual forum doesn't mean it's not effective.
I think I would echo that as well, particularly for maybe some of our junior grades who feel that they need to have some kind of outcome that's dietetic related at the end of that consultation, and it sometimes is just about building that rapport. Absolutely. And gaining that confidence of a patient. Okay, so the next question is from Julie. Do you use a form to consent for emails when asking people to do email food diaries, or do you seek consent for virtual consultation as well?
So we, it tends to be done verbally. We do a partial booking service we don't actually use the central booking hub. So our own administrators within our department do our booking, which means that we have greater control over, we send out a lot of our invite to phones so that we're not automatically booking patient into appointments. So you're already getting consent and agreement to take part in the process through that. And then we verbally ask if they are happy to be emailed. We will always send them an email first to check that that is their address and they're happy to communicate in the way, and ask them to respond to that. And once they've established that as a safe network, and we're NHS Net users as well within our trust, then yeah, but we don't have a specific form that we use just because the way that it's so within the department, the way we book our appointments.
I'm going to give you a break, Kirsty. And we've got a question from Emma for Dr. Scott. Do you have any tips to encourage interactions of teams and department meetings? I feel like I do almost all of the talking. I share that as well, Emma. Yeah, it can happen.
Yeah, know the feeling, Emma. I think if you're hosting a meeting over something like Zoom, where you might have 10, maybe 20 participants, it's really difficult to throw a question out to the whole audience, because what usually happens is that everybody thinks, I don't want to speak, and then everybody speaks at once. And we've all had that. It's like doing the two-step. It goes, and nobody gets it. I think it's really good to sense check with open questions. So, to take a pause and to say, how do you feel about it? But I would direct it to somebody specific. So Emma, how do you feel about the response that I've just given, or what are your thoughts about that? Does anybody else have an experience they'd like to share? And just framing the question, but being a little bit more targeted and bringing a couple of people in, that usually opens things up a little bit, but I sense your pain.
Fab. And then a question from Suki again. This is to Kirsty. How do you manage patient consults where you need an interpreter?
So in our trust, we, although we use Attend Anywhere and that's our preferred platform, we have our partnership that for the interpreting services actually use Zoom. So it's a Zoom-based three-way process, and it's actually organised and set up by the interpreting service. So they do all of the consent and everything. So it's actually booked externally when we need to use interpreters.
So within ESHT, we link them in through Attend Anywhere, so it's all done through an external interpreter company as well, that link them in, and they have a dedicated time where they join in with that patient if we know in advance when they're going to be there. And we can do something similar for British Sign Language interpreting also, which is helpful. Another question for you, Kirsty, from Sharon. How long would you have for each virtual Attend Anywhere or telephone consultation? I think you maybe mentioned this in your presentation.
Yeah, so we aim for 30 minutes. Most consultations can be done within that time. FODMAP sometimes take a little bit longer. So for if I've got somebody that I try to tend to book them at the end of the clinic if they're going to be lots of questions, but generally 30 minutes.
Okay, and another one from you from Sheila. How do you get them back on topic if you're on the phone, as you don't have any visual cues or a diet sheet to draw them in without sounding like you're butting in and stopping them from talking?
Yeah, it can be a tricky one, and obviously it depends very much on the personality. But if it gets to the point where you're struggling to find a moment to sort of to interject, then it's about waiting for a pause in conversation and say, I think I'm just to make you aware we've only got 10 minutes left, and I'm quite keen that we start to work out where this is all really good information, but it's a good idea to start thinking about how we can start planning what treatment goals we might be looking at and what the plan's going to be. So yeah, just trying to get them back on track that way. But it's it can be a challenge, but you get much more efficient the more you do of these. And I really do think that the Proformers help, because they help you realize how far you've got to get through your assessment before you can then sort of let them speak freely. So yeah.
Great. And a question from Sharon. This is probably best for you, Scott. Is there a problem with confidentiality or data protection with some of the software?
That's a great question. I mean, the short answer, Sharon, is that there should not be, because a properly built platform for communicating should have done a proper data protection impact assessment. So a lot of thought about the minimum amount of data required to deliver the service. With the general data protection regulations, which came into effect about 2.5 years ago, there was a huge clarification. People talk about tightening up, but actually just made it really, really clear about the things that you can and cannot do with personal data and sensitive information, which of course we're dealing with in the medical space. There's lots of horror stories, and there always will be horror stories in the news because they attract attention. But I can tell you from the experience of building apps and working in this space, that the amount of security that organizations like Google, like Apple, you have to submit very heavily detailed information about the level of security of your apps. So if you stick to the brand names, the well-known favorites, then you should be safe. But also do bear in mind that just because you're using an app doesn't mean that you have the necessary permissions to ask the questions. So you do have to rely on a balance between the contract that you have for the service that you're providing with the patient and also the technology you're using to supply.
I suppose in addition to that, all trusts will have their own governance process that you've got to take these things through as well. So it's always worth checking what your escalation route is for those internal governance processes, because even though it might be safe, your trust might decide they don't want to move forward with it. Always worth checking.
Yeah.
A question from Tracy Joy. So is it possible to share your leaflet for patient explaining Attend Anywhere and any consultation Proformers in the same way?
Yeah, absolutely. I have I'm quite happy to share what we've developed. The Attend Anywhere leaflet actually is generated automatically through the program. So if you're using that within your trust, then it's quite simple. But yeah, I'm happy to share the Proformers. Anyone's welcome to email me if they want that. It's kirsty.dobson@nhs.net even. So it's quite simple.
Thank you. And Catherine has asked around that adapting of teams. So how have the dietitians in your teams adapted to this change? Has there been much resistance? And if so, how have you overcome it? I think I mentioned in the start at the intro, Catherine, that we did have some resistance within the team, and that was mostly around the unknown of how that was going to work. how the system was going to play out, what technical glitches were we going to have. And a lot of that has been overcome around trialing it with one or two individuals that were quite keen to try that as an option, and then through their successes and also any challenges that they came across, sharing that back with the team so that we could see how it was going to interact with patients, what hiccups that we might foresee happening as well, and then try and just gain that confidence with the rest of the team just to try it. And if it didn't work, we were prepared to look at trying to do something different. But Kirsty, I don't know if you had any similar challenges.
Yeah, I think our team were most people were fairly comfortable with phone already, but it was just getting used to doing the video calls, and actually having done, because it took a little while before we got set up with a dietitian's waiting room in order to use Attend Anywhere, because I think the demand at the peak of the pandemic was so high that lots of different departments got in there before us, so we had to wait a little bit. But it meant that when we started doing virtual consults, actually, and seeing the video calls, a lot of the dietitians were saying, oh, it's so much nicer to actually be able to see the patient in front of me. I didn't realize how much I was missing by not being able to visualize them, particularly if it was somebody that they'd not met before. So just, building that rapport and that bond with somebody. So yeah, and I think most people have found, as long as they've got a reliable, network connection. I have a bit of an issue in that I'm one of those clinics that we're trying to keep in a clinic room so that I have a face-to-face facility if necessary. And unfortunately, because it's in the valley in Brighton, I seem to have like really patchy connections. So I, having been invited to come and talk about video calls, I haven't had a great deal of success myself, but when I've done them from home, where my internet connection is better, it's been much more reliable. And I know my colleagues have actually got very much into it now and realize how much flexibility it offers them in being able to work from home. And as I said, that has become a real benefit in just reducing the numbers that are trying to use the office so that we can socially distance better.
Scott, I don't know if there's anything you want to add to that at all about that influencing of and winning people over.
Yeah, I mean, I think it's really important that again, ban the word digital. It's telephone plus. There's often a great fear as well that this is trying to replace that personal one-to-one connection with people, where actually what we're trying to do is enhance that connection, to give carers another tool, nurses another tool, doctors another tool to connect with people. But also it comes down to this thing about using the software, and the software should really be intuitive. It should be extremely simple, and that's the job of the people who designed the software, to make it intuitive, to make it simple. You don't get a manual, you don't get a letter through the post when you download Uber or the Trainline or the Just Eat app. It should be relatively straightforward. Green means pick up, red means put down. I can see the picture, I can turn off the picture. So it's that cultural piece. And a lot of people put off that, I don't like apps, I don't like phones, etc. Well, you do if they're useful to you. So it's getting over that slight hurdle. And the best thing to do is to jump in, show some people. And if you're looking at bringing a team on board, one of the things that's worked really well with the Homeward app is having champions, having super users. So not trying to convince 100 nurses to use the app in one go, but actually get 5 or 6 people who are comfortable to have a play, to sit down, start using it, and then realize that actually this isn't that scary, and then have the trainers training everybody else and roll it out in a measured way.
Yeah, definitely agree with that. So a question from Emma. How did you adapt your appointment booking process for Attend Anywhere? Did you have to email consent of the point of referral, or did the patients post their email consent? Which I think we've covered that one, but I'm not sure if there's anything else you want to add, Kirsty.
Yeah, no, we haven't adapted our process at all. We just had to change our letters just to make them aware that not to attend in person. We do still sometimes get people that don't read letters. We know this, and they do sometimes still attend in person. But yeah. Other than that, there was very little change.
Perfect.
Can I put in a massive plug there for the Nutrition Homeward app, because we were kind of invested in it. So one of the things that I was really interested to hear was about the change in non-attendance dropping from 28% down to 5%. It was one of the things we were very conscious of when we were designing the app with Nutrition team. So there's inbuilt scheduling. So that means that when a member of the team, they could be on the move or they might be back at home, create an appointment, the schedule's updated in the patient's phone automatically, and they also receive notifications before the appointment, so the day before the appointment, 15 minutes before the appointment, just to prompt them, and that seems to have a very positive effect on scheduling and avoiding these non-attendance.
Great.
So we have 3 questions left. Let's see if we can get through them all before we end. So a question from Catherine: are dietetic assistant practitioners also involved with virtual consultations?
So sadly, we only have one dietetic assistant practitioner that works in our particular department, and she works in our rehab centre, so she doesn't do any outpatient facilities. So I can't actually answer that question. I don't know whether you've got experience, Carol.
We have several DAPs who we haven't yet got them onto the virtual platform. They do the telephone calls, but that would be the next step for also getting them to support those patients. And why shouldn't they be able to see patients face to face as well? We trust them and build that competence around telephone calls. So virtual is just an extension of the telephone calls, as Scott's already said. So next question from Rachel. Hello, fab presentations. Have you used the video calls to monitor meal times for fussy eaters?
So I know our paediatric dietitians do quite a lot of joint feeding clinics, and they've been actually using Attend Anywhere for a bit longer than we have in adult dietetics, with again mixed success. I think there have been some meal observations done, but they find the kids get very distracted and a bit silly and hysterical, and you might sometimes get a child naked running around the backgrounds. And so I think there's been, you know, I think some of the clinicians are maybe a bit over it, but yeah, with some families, I think that can work really well. And being able to, you know, visually have a look in someone's fridge and all of that kind of thing, you wouldn't be able to do that when they were in a clinic room with you. So I think there are, you know, there are advantages and little insights into people's homes that we wouldn't get if we were seeing someone traditionally.
And lastly, from Naomi, are all your appointments booked by the patient selecting a preferred time and date, or do you just send the next available out?
So we have, I mean, obviously we have a triaging system. So we have goals for depending on the priority of each of the referrals, and then the dietitian sets goals for the follow-up schedule. But we generally will always call our administrators call the patients and offer them their preferred slot booking. So we have the clinic schedule, and they will be able to offer them. I mean, we run 20 clinics across the week, so we're able to give them a choice of day and time.
And we are similar, where patients call us to book an appointment, so you have that opportunity to pick a time that suits best. And again, anywhere across the patch within East Sussex, a patient can choose to go, which is helpful. Okay, so that's all our questions. Thank you very much for joining in. And as far as I'm aware, this has been recorded and it will be added to the Nutrisha website. So thank you very much for joining us, everybody.
Thank you.
Thanks, everyone.